Hi, welcome to the Radiology Everywhere YouTube channel. In this video, we briefly discuss the radiological findings of asbestos-related lung diseases. Pleural diseases related to asbestos include pleural plaques, benign pleural effusion, round atelectasis, and malignant mesothelioma. Pleural plaques. This is the commonest presentation. It is usually developed after 20 to 30 years of exposure. It is seen on the ribs undersurface and diaphragmatic pleura. And next to the spine is pathognomonic. On chest X-rays, they appear as sharply angulated holly leaf opacities. Benign pleural effusion. The most common early manifestation. Seen in less than 10% of cases. It may be unilateral or bilateral and/or residual benign diffuse pleural thickening. Diffuse pleural thickening. This is less specific. Round atelectasis. This is a peripheral rounded mass with adjacent pleural thickening. And parenchymal bands or distortion, also called comet tail appearance. Malignant mesothelioma. This has a long latency of about 30-40 years. Histologically similar to usual interstitial pneumonia. Lesions are seen as lobulated pleural thickening in mediastinal pleura with or without large pleural effusion. But there is a minimal mediastinal shift. Lung parenchymal disease includes asbestosis and lung cancer. Asbestosis has a long latency of about 30-40 years. This is also similar to usual interstitial pneumonia histologically. Subpleural lines paralleling the chest wall are an early feature. Lung cancer risk is increased even with the absence of smoking or asbestosis. Other associations are peritoneal mesothelioma, laryngeal carcinoma, and ovarian cancer. If you liked the video, share it with your friends. Subscribe to the Radiology Everywhere YouTube channel. See you soon. Bye-bye.